If you've been diagnosed with a serious heart condition and you're thinking about applying for Social Security disability, there's something important you need to know. If you're new here, my name is Maria Bermudez, and I'm the managing attorney of Disability Advocacy Group. And we help people secure Social Security and long-term disability benefits. A lot of people believe that having heart disease automatically means they will be approved for benefits. But that's not always how Social Security looks at it. Here's the good news. Social Security understands that heart conditions can make it impossible to work. They have specific medical rules for heart disease, and many people qualify under those rules. And even if you do not meet those exact rules, you can still qualify if your condition limits what you can do in a full-time job. Today, I'm going to explain both ways Social Security evaluates heart conditions. First, how cases are approved using medical listings. And second, how cases are approved by looking at physical limitations, even when a listing is not met. Let's break this down in a simple way. First, let's talk about medical listings. Social Security has a guide called the Listing of Impairments. This is a list of medical conditions that are considered serious enough to qualify for disability automatically, as long as all medical requirements are met. For heart conditions, some of the most common listings involve chronic heart failure, ischemic heart disease, dangerous heart rhythm problems, congenital heart disease, and heart transplant cases. To meet a listing for Social Security does not focus on how you feel. They focus on medical proof. For example, in cases of chronic heart failure, Social Security will look for a clear diagnosis from a doctor. Test results showing poor heart function and measurements such as low ejection fraction, which shows how well the heart pumps blood. They also look for ongoing symptoms like shortness of breath, extreme fatigue, even with treatment, along with proof such as abnormal stress tests or repeated hospital visits. Here's the key point. Your symptoms matter, but only when tests and medical records support them. Simply saying that you are exhausted or short of breath is not enough on its own. Social Security needs medical tests, hospital records, and doctor's notes that clearly show why those symptoms exist. If you meet all of the requirements of a listing, your case can be approved rather quickly. But many people do not meet a listing, and that does not mean their case is over. So what happens if you don't meet a listing? When that happens, Social Security looks at something called your residual functional capacity. We call it RFC internally all the time. This is how Social Security decides what you can still do on a full-time basis, even with your heart condition. They are looking at whether you can work 8 hours a day, 5 days a week without needing special breaks or extra time off. This is where many heart condition cases can get approved. Social Security looks at your symptoms such as fatigue, chest pain, dizziness, shortness of breath, and heart palpitations. They also look at your physical limits, including how long you can stand for, how long you can walk for, how much weight you can safely lift, and whether you can sit upright for long periods of time. They also consider limits in the work environment. This includes problems with stairs, difficulty tolerating heat, cold, humidity, physical stress that puts a strain on your heart. They also look at safety and endurance issues, such as the risk of sudden symptoms, difficulty using machinery, or the need to avoid physically demanding tasks. Finally, they consider factors that can prevent full-time work. This includes needing unscheduled breaks, being off task during the day, or missing work often because symptoms or medical appointments. And this is very important to understand. Being able to do something once does not mean you can do it every day. Social Security looks at whether you can work consistently, not just on a good day. Medical records play a major role in these cases. Social Security often reviews heart ultrasounds, stress tests, cardiac catheterization results, ejection fraction numbers, imaging like CT scans or MRIs, emergency room visits, and notes from heart specialists or even your primary care doctor. Doctors' opinions can also help, but only if they're specific and supported by your medical records. Strong doctors' opinions show exact limitations, like how much the person can lift, how much they can stand, how much they can walk, how often they would miss work because of their symptoms. What usually does not help are simple statements from a doctor saying the patient is disabled or the patient can't work. Social Security often ignores those statements unless the doctor clearly explains using medical details and supported records why they can't work. If you're applying for disability with a heart condition, there are a few important steps that can strengthen your case. Make sure all of your heart-related medical records are collected, including hospital stays and testing. Ask your doctor to complete a form that explains what you can and cannot do physically. Be clear about how your symptoms affect daily life, such as walking, standing, and recovering after any incidents that you may have. Be honest and detailed on Social Security's forms because consistency matters. These steps help Social Security understand how your condition truly affects your ability to work full-time. If you're living with a serious heart condition, you may qualify for Social Security disability. Some people qualify by meeting a medical listing, others qualify by showing they cannot keep up with full-time work, or what we call substantial gainful activity. Understanding how Social Security evaluates heart conditions can help you avoid mistakes and build a stronger claim. If this video helped you, make sure to subscribe for more clear and practical guidance about Social Security disability. Thanks for watching, and I'll see you in the next video.